you know, my new book, Epigenetics, is out, and it's just kind of going like crazy. I'm starting to get rave reviews here from very, very well-respected medical doctors around the world who just are just going crazy over the information in the book, Epigenetics. The subtitle, of course, is The Death of the Genetic Theory of Disease Transmission. And people always say to me, well, what are we talking about here, the death of the genetic theory of disease transmission? Well, remember, there's thousands and thousands and thousands and thousands and thousands of failed medical theories since the days of Egyptian physicians writing things down 6,000, 7,000, 8,000 years ago. And these failed medical theories didn't stop 5,000 years ago. They're ongoing, okay? Alzheimer's disease has been claimed to be genetic. It's not. Diabetes, type 2 diabetes, is said to be genetic. It's not. High blood pressure is said to be genetic. It's not. Heart disease of all its various manifestations is said to be genetically transmitted. It's not. Cancer is supposed to be genetic. It's not. Obesity is supposed to be genetic. It's not. And of course, all the details and all the references and all the examples and so forth and all the references proving what I'm saying here are quite correct. Okay? And, of course, James Watson, one of the two guys, he and Francis Crick got the Nobel Prize in 1962 for the proposal that DNA was comprised of a double helix structure back in 1953. And in his response to the sodium chloride part, the chloride part of the salt is required as a raw material to make stomach acid to digest proteins. And so over the last 50 years, gluten intolerance, celiac disease, irritable bowel syndrome, inflammatory bowel disease, ulcerative colitis, diverticulitis, and Crohn's disease have gone up 400% because you can't digest these proteins from grains without stomach acid. Pepsin won't work without stomach acid. Your stomach environment has to be very, very sterile, very acid to pull that off. And then, of course, you get reflux when your stomach acid level is more towards neutral instead of like battery acid, because bugs will not grow in your stomach when your stomach acid is down to the level of battery acid. When it starts pushing towards neutral, suddenly now yeast and bacteria can grow, and every time you take in sugar, fiber, or carbohydrates, you get reflux. And doctors make you call it acid reflux. It really should be called lack of acid reflux. So at any rate, the first thing a good farmer puts out for his livestock is a salt block. And, there's nobody out in the pasture telling a cow she's limited to 1 lick a day. And so I can't believe that my patients are dumber than the cow. All you have to do is salt your food to taste. You get in the amount of salt you want. And, of course, you're more likely to absorb minerals when your stomach is acid. The more mineral you absorb, the less likely you are to have high blood pressure, because in most cases, other than PAD, other than peripheral artery disease, the most common cause of high blood pressure is mineral deficiency. So here's where the 90 for Life campaign, here's where the 90 essential nutrients, the Mighty 90, the Almighty 90, will do the job. And, of course, if people have coronary artery disease, they have vascular dementia, they have kidney failure, or if you just have high blood pressure and you want to really go after it, you want to support and promote healthy blood flow through blocked arteries, you want to support and promote healthy blood pressure, to that 90 essential nutrients, to the 90 for Life, you want to add what we call ultimate daily tablets. They're designed to do that. They're designed to support and promote healthy blood flow. They're designed to support and promote healthy blood pressure. Now, we do have liquid chocolate and chocolate pieces called triple truffle chocolate and triple treat chocolate, and the liquid chocolate is called Cocogivity Plus. And these chocolates actually have flavanols in them, a natural substance, one of the many, maybe 100 different natural substances found in chocolate. And the flavanols actually will lower blood pressure. This was published in the Journal of the American Medical Association, August of 2003. And there's no doubt about it. Now, certainly the flavanols in chocolate will not solve the mineral deficiencies that are the basic root cause of high blood pressure. However, the flavanols in dark chocolate will lower blood pressure, much like chocolate is an herb. It's a plant medicine. So it will lower your blood pressure in much the same manner that chemical blood pressure control drugs will do, but no negative side effects. So I take in probably six of those triple truffle chocolates a day, 2 at breakfast, 2 at lunch, 2 at dinner. I use the Cocogivity Plus, the liquid chocolate, in my coffee, so I'm making my own mocha cafe. And so I'm getting my blood pressure down to where it's 121/71. I take the Ultimate Daily tablets. I take 3 of those twice a day. I've never had high blood pressure problems, but I take it to prevent high blood pressure problems, right? And of course, every time I go through another little town, I'll run into some pharmacy that has these little chairs. You put your arm in there, push the button, and I get my blood pressure and my pulse. My blood pressure on the average runs 121 over 71, sometimes down to 112 over 68. But usually it's like 171 over 21. My resting pulse is 43. I do admit when I get angry and upset, it'll spike up to 45. When I wrestled for the University of Missouri, my resting pulse was 38. Medical doctors have no earthly idea what a normal pulse is. They would probably take me in and insist that I have a pacemaker put in and put me on the heart transplant list. Well, I'll outlive them. I already have. Their average lifespan is 56, according to their own study. So once you get a hold of the book, Dead Doctors Don't Lie, the original Dead Doctors Don't Lie, get a hold of the CD, Dead Doctors Don't Lie, and you'll get the picture. Oh, yeah, if you want to know the newest information, on top of the original stuff, which is still true, get a hold of the book Immortality and the CD called From Here to Immortality. Well, we'll be back with more truth, justice, and the FDI longevity way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us?
Well, I thought we'd talk about heart attacks here, as I've got a story that came from Business Standard, and the headline reads, "Heart attack at hospital may up death risk." They say patients who experience a certain type of heart attack during hospitalization face a greater risk of death than outpatients, according to a study that was done at the University of North Carolina, Chapel Hill, by a Prashant Kaul. Says focused on heart condition, called an ST elevation myocardial infarction. So they found that patients developing inpatient myocardial infarction were more than threefold greater in-hospital mortality than outpatient onset, 33.6% compared to 9.2%. You say this type is a certain type of heart attack that has a certain pattern that is on a electrocardiogram following a heart attack. And a study included an analysis occurring between 2008 and 2011 and identified in the California State Inpatient Database, and the patients with inpatient onset myocardial infarction were also less likely to be discharged to home, 33.7% compared to 69.4%. And they also said that they were less likely to undergo cardiac catheterization, 33.8% versus 77.8%, or PCI, 21.6% versus 65%. That is, average length of stay was 13 days versus 5 days. And inpatient charges, $245,000 compared to $129,000. This all came out of the Journal of the American Medical Association. So if you're going to have a heart attack, do it at home. You're more likely to survive. And in another article out of another publication, they said patients presenting emergency departments with suspected myocardial infarctions are much more likely to undergo more invasive treatments and get drugs and things. So most likely that's the cause of why you're more likely to 300% more. I was shocked to see that.
Well, I'm not shocked to see that. That's why the hospital statistics are so terrible, because you're in there, and either you have good insurance, or you have the Affordable Health Care Act, or you have Medicare, Medicaid. Doctors are going to leverage all that into maximizing your treatment. And, of course, over-treatment, doing screening tests you don't need, that kills each month. Just doing screening tests you don't need in hospitals caused the death of 15,000 seniors. That's 180,000 a year. Seniors are killed in hospitals just from doing unneeded screening tests because they're in the hospital, okay, because Medicare will pay. And so these are things that as a patient you need to just not sign off and, oh, yeah, whatever you say, doctor, don't do that. I urge you to get a hold of the trilogy of books, Let's Play Doctor, Let's Be Herbal Doctor, and the Passport to Aromatherapy, and see what all these things mean. It'll blow your mind how much you can do yourself if you're educated. You know, it's even biblical. If you're biblically orientated, the good Lord says, my people are destroyed for lack of knowledge. And that includes being in the hospital. Just think about it. What other trade can kill, injure, and infect 15 million of their customers at their workplace not even get an OSHA ticket? What other trade can kill, injure, and infect 15 million of their customers in their workplace? In this case, patients in hospitals and clinics and private offices. Doctors kill, injure, and infect 15 million a year. They don't even get an OSHA ticket. They don't get a parking ticket. They don't get their license suspended for 3 seconds because they're a protected monopoly. They're a protected monopoly for 100 years. They're self-policing and have no oversight by anybody. And so it's incumbent upon yourself to actually take care of yourself as much as you can. Obviously, you get run over by a truck, you need to go to the emergency room. But then your prayer on the way to the emergency room should be, I hope the emergency room doctor I get is not on street drugs, prescription drugs, or alcohol. Okay? And again, get a hold of my new book, Epigenetics, The Death of the Genetic Disease Transmission, and stay away from unnecessary screening tests. Stay away from the hospital if all possible. You'll live longer. What? You'll live longer if you stay away from hospitals. We'll be back with Dead Doctors Don't Lie for these messages. Thank you, Doug. Okay. Doug, let's go to callers.
Well, let's head to Michigan. And Emma, you're on with Dr. Wallach.
Hello, Emma. You're on the air.
Hi, Dr. Wallach.
Hi.
My granddaughter has two little girls, ages 3 and 4. They've been diagnosed with navel hernias that the doctors want to do surgery on. So I'm calling to see if you could suggest something that could be done other than surgery.
Okay, well, navel hernias, belly button hernias, are actually caused by mama missing something, usually zinc and folic acid, during pregnancy at the point when the embryo goes from a flat disc into a tube. And the belly wall doesn't completely close. And so these belly button hernias can be as big around as a pencil lead, as big around as a pencil, big around as your little finger. They can be as big around as a carrot. They can be pretty big, including, baseball size lump of your intestines or body fat can come out there. And these things aren't genetic in any way. Nutritional supplementation at this stage is not going to reverse them. They're preventable, okay, but not reversible. So if your granddaughter plans on having more children, I definitely recommend that she get on a gluten-free diet and supplement with all 90 essential nutrients, and that will significantly reduce the risk of her having any more of these types of birth defects. Now, it depends on how big they are. If they're the size of, a pencil lead, sometimes just irritating them can have them grow together and seal off. By irritating them, I mean you can sit there while they're watching TV and take your index finger and just stick your finger in their belly button and kind of work it around so you're kind of irritating it a little bit, and it'll cause them to get a callus in there and it'll close up. If they're big enough to put your little finger in, they could be problematic later on in life. And so I'd get 2 or 3 opinions and see if this is something that requires surgery. I'd get 2 or 3 opinions before you go ahead with it. It may be that the surgery is minor enough they can use a hypnotic where they're not totally anesthetized, totally under anesthesia, and they can use a local and a hypnotic, and it might take just 10 minutes to suture this thing up, and with a local and a hypnotic as opposed to deep anesthesia. So those are all kind of options you want to ask about, and let me know what they say. And of course, if you can find out what the measurements are, that'll be easier for me to give some recommendations. But nutrition will not reverse any type of hernia, but it can prevent hernias. Okay, Doug, we got time to start another one? Nope, well, that answers that question. Well, stick with us, and we're going to be back with more Truth, Justice, and the Longevity Way on Dead Doctors Don't Lie after these messages.
Let's head to Tennessee, and Jan, you're on with Dr. Wallach.
Oh, Jan, you're on the air.
Hello, how are you today?
Fine, thank you. How can I help you?
I have a woman that contacted my husband and I. She actually has venous reflux disease, and the doctors are wanting to do a venous closure procedure, but she wanted to see if there was anything she could do before having that procedure done.
Okay, now what are you talking about? Is this in her legs? Is this in her lungs? Is it in her heart? Where is it at?
I'm sorry, it's in her legs.
Mm-hmm. Okay. And so venous reflux. Now, how is it manifesting itself with edema in her legs or varicose veins? What are we talking about?
It's edema in her legs.
Edema in her legs.
Yeah, and she's on 800 milligrams of Motrin, and they have her on Trimadel for pain.
Mm-hmm. So it is uncomfortable.
Yes, it is. It's getting very uncomfortable,
sure.
But she's still, she's trying to find other ways
sure.
to not have surgery.
How much does she weigh?
She's 110 pounds.
Okay, and do you know if she has any other issues, any respiratory stuff or diabetes or high blood pressure?
The only thing she has is asthma, and we've already told her she needs to go to gluten-free diet.
Well, exactly right. And Shar, you might have some input here. And you would confirm that she has gluten problems, right, with the asthma?
Yes.
Okay. Now, what would you do for blood vessel problems here? She's got maybe some dilated blood vessels in her legs. She's getting edema in her legs. What would you do to support healthy circulation here?
I would give her the Ultimate Daily.
Okay, very good. And 110 pounds, I'd have her take 3 of those Ultimate Daily tablets twice a day. That would be 1 bottle a month because it's a big bottle. It's designed to support and promote healthy blood flow through obstructed vessels, also to promote healthy blood pressure levels. Also, at 110 pounds, what basic program would you give her, Shar?
I'd give her the Healthy Start Pack 2.0.
Well, there you go. It's a drop-dead gluten-free Healthy Start Pack 2.0. Have her take a half a dose for everything at breakfast, half a dose at dinner time. And the only additive we'd throw in there, as Shar said, the Ultimate Daily tablets, 3 twice a day. It's 1 bottle a month. It's imperative also that she stay away from inflammatory foods. This would mean absolutely no fried foods, no processed meats with nitrates, nitrites, no oils. That includes olive oil and coconut oil, margarine, mayonnaise, salad dressing, cooking oils, and no gluten. Yeah, when you have asthma, that's one of the drop-dead signals you have a gluten intolerance. Call us every couple of weeks, Jan. Let us know how this lady's doing. The odds are she won't need surgery unless there's other things that we don't know about. Okay, Doug, let's start another one.
All right, let's head to Florida. And Andrew, you're on with Dr. Wallach.
Andrew, you're on the air.
Good afternoon, Doctor. God bless you for the work you do. I have 2 questions. One that has to do with your product. Months ago, I purchased the Tangerine with the vanilla flavor also, and the Ultimate EFA Plus. After 3 weeks, I experienced agitation and...
Okay, well, hang on a second. Wait a minute, Andrew. We got to run one of those message moments. Hang on to that thought. We'll be back with you and your agitation after these messages. Okay, Doug, let's go back to Florida and Andrew. Let's back up a little bit here, Andrew. Let's see here. How old are you, sir?
51.
Okay, great. And how much you weigh?
170.
And how tall are you, sir?
5'11".
Okay, very good. Now, do you have any other issues, any diabetes or high blood pressure, low blood sugar, skin problems, constipation, irritable bowel syndrome, anything?
None.
Okay, good. And when you take the Beyond Tangerine, are you taking it on an empty stomach or with a stomach that's half full of food?
Honestly, I tried it both ways.
Okay.
And when I took it with food, along with the pills, the Solanges, that's when I puked.
Mm-hmm. Okay. So you do better when you don't take the liquid with the pills?
Yes.
Okay, well, that's very obvious. Then I wouldn't take it. Yeah, I wouldn't take the pills along with the liquid then, and it wouldn't hurt to cut the dosages in half. Myself, I take the Healthy Start Packs Plus twice a day myself, but I wait until my stomach's half full before I start taking all my supplement pills and the liquids and so forth. I do half doses. I might take a full dose over an hour's period of time as opposed to trying to jam it down. And if you know that your stomach can't tolerate the tablets and pills and capsules along with the liquids, just separate them out and take longer to consume the liquids. Don't try and do it in a short period of time. Try doing it, say, over a period of an hour instead of a period of 10 minutes. And you might find you're better off with these sorts of things. And, it sounds like a mechanical problem. Because you do have different responses based on when you take things together and this, that, and the other. And so I would just kind of do a little experimentation here, there. And when you figure it out, you call us back and let us know which works best for you. Okay, Doug, let's go to callers.
All right, let's head to Spokane, Washington. And Michael, you're on with Dr. Wallach.
Okay, Michael, you're on the air.
Yes, sir. Appreciate your ministry unto the Lord. I think you're one of God's gifts on the earth. And
well, you're very kind. Thank you. I do appreciate the good Lord and give him all the credit.
Well, I tell you what, I called 6 months ago. I guess I got forced into retirement as a pastor for close to 30 years.
Wow.
But anyway, just to make a long story short, because I really need your counsel, but I don't. Tell me when to shut up.
Okay.
Because I don't want to hog all the. Sure. I called you up. I was diagnosed with stage 3 kidney disease.
Mm-hmm.
And it started with a visit to the doctor, and he discovered my creatinine level was 250. And then he took...
Wait a minute, your creatinine level was 250?
No, 2.5, I'm sorry.
Okay. Well, that's pretty low. Creatinine, they don't start talking about kidney failure until you're up to around 4 or 5, 2.5. I like to see it 0.9 is where you need to be, but it's not a crisis, but it's kind of an eyebrow-raising thing.
Well, anyway, to make a long story short, I had colon cancer for 6 years ago. I was diagnosed with colon cancer.
Okay.
And to make a long story short, because I really want to get through this, they took a third of my colon out. They said it then they told me that it spread all over the lymph nodes, blah blah blah, and then I had to have chemo. I went in and had the chemo, and during one of the end of the 4th month of chemo, I was in the infusion room, and I was dying. I thought, man, I'm choking. I'm turning. I turned the color of a lobster. They said, and so they rushed the doctors in, shot me up with something, and I came back out of it. The chemotherapist says to me the next day, Mike, you had a fatal reaction, almost fatal reaction to the chemo. Well, with a federal marshal then, she said, well, we got to take you off chemo. About a week later, a federal marshal came out and interviewed me and asked me what happened. And so I told him, blah, blah, blah. Anyway, I went back to the chemotherapist, and she says, well, we want to have a 2-year test on you. So after 2 years, they said, well, you don't have any cancer. And I said, okay. Where do I go from here? What do I eat? She says, well, eat whatever you want. Well, anyway, I just said, well, okay, see you later. And so, okay, then I go I finally had enough of going to all these doctors, because I had gone to doctors, surgeons, blood work over 60 times in 2 years. And I just said, you know what? I'm not going to take any more scans. I've had it. Lord, heal me or take me home. Do something. And I'm not going back to them.
Okay, so okay here, Michael. Where are we at now? Because we're going to run out of time here.
Yeah, well, anyway, 2.5 creatinine level.
Mm-hmm.
He then has me have an ultrasound, and they discovered, I got the findings in front of me, the damage to my kidney. I had 3rd-stage kidney disease, and he gives all the findings on that. And then he refers me to a urologist and they do a resectum of my prostate. And I could tell you just nightmares what happened from that.
Yeah, why did they take your prostate out?
Because the prostate was swollen over the tube, and it was supposedly damaging kicking urine back up or something into my kidney. And they said, you've got to do this to free that.
Well, I'm sorry you didn't get a second and third opinion, because it's probably not true. They may have needed a Mercedes payment, right? At any rate, let's deal with this creatinine level here. What do you weigh, sir?
Well, when all this started, I weighed 212.
Yeah, what do you weigh now?
Well, I weigh 180 because I've been on your diet.
Yeah.
Okay.
Okay, good. Okay, 180. And let's see here. Do you have any diabetes or anything like that?
Well, they diagnosed me years and years and years and years ago. It's pre-diabetic, but I've never taken anything for that.
Okay, well, let's say 180 pounds. You have early kidney failure. Char, what would you do for somebody with kidney problems, kind of a pre-diabetic, 180 pounds?
I would put them on 2 healthy blood sugar packs, and then I would add the Ultimate Daily to that.
Okay, very, very good advice. Okay, so Char's exactly right. It's 1 per 100 pounds of body weight from the healthy blood sugar packs. And since you're pre-diabetic, I don't like to wait until people get full-blown diseases. If you know they're kind of a pre-something, you want to deal with it and support and promote healthy blood sugar levels. You want to support and promote healthy A1C hemoglobin. You want to support and promote healthy sugar, carbohydrate, and fat metabolism at the cellular level. You also want to support healthy kidney function. And almost always when you have kidney failure, your creatinine is high. Very rarely is there anything wrong with the kidney itself. Maybe that might not be a true statement for chemotherapy secondary injury, but most of the time, people don't have kidney problems when you have kidney failure. It's just that they get obstruction of the little arteries carrying the dirty blood into the filtering units. So the 2 healthy blood sugar packs, 1 full dose of everything at breakfast, 1 full dose of everything at dinner time, and then the Ultimate Daily tablets. Take 3 twice a day. That's 1 bottle a month. And they're designed to support healthy blood flow through obstructed arteries, including the brain, the eyes, the heart, and the kidneys. They're designed to support and promote healthy blood flow and healthy blood pressure. And then, every time you go in for a creatinine level, call us back and let us know what's going on there. But stay away from sugar and the fried foods and the processed meats and the gluten. Stay away from the inflammatory foods. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity, 90 for Life Crusade. And Doug, let's go to callers.
All right, let's head to Ohio. And Jim, you're on with Dr. Wallach.
Jim, you're on the air.
Hey, Doc, how's it going?
Fabulous, sir. How can we help you?
I am calling for a friend who has a 11-month-old male Rottweiler, weighs about 102 pounds. He's got 2 problems. He has entropion in the eyes, and he's had surgery already. One took fairly well, the other one didn't. And he was also just recently diagnosed with hip dysplasia. And I gave her a sample of Arthrodex to try, which he loves, and we got 4 containers on order for her. And I was just checking to see what else you would recommend, if anything, other than the Arthrodex.
Okay, well, hip dysplasia, shoulder dysplasia in big dogs is not genetic, as was believed by the veterinary profession, for 50 years. We see this all the time. It's actually by giving them dog food that doesn't have enough minerals in it for the body weight. And so Arthrodex is a fabulous choice. That's 1 scoop for 25 pounds of body weight, so at 102 pounds, it'd be 4 scoops a day. But I would also give that dog 5 glucogel capsules a day, too. And open them up, dump the powder in. And this is going to be the raw materials to support and promote maintenance repair of the cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself. So all the complicated joints in the hip and the shoulder and everything, this resolves very quickly because it's not a genetic disease. It's a simple nutritional deficiency. And when you have the entropion in the eye, this is where this third eyelid is causing problems. Is that?
Yes.
Yeah, and it gets swollen up, and they usually do a little bit of surgery on there, and it usually solves the problem. And so what I would do is make sure that the dog food is gluten-free, because even dog food has gluten in it, and a lot of times it'll show up as kind of like a rosacea, and it shows up in those third eyelids, the nicotinating membrane. And then also I would give that dog some drops of our colloidal silver in the eye, and that will sort of reduce the bacterial and yeast load and that kind of stuff in the eye itself, reduce some of that swelling. Wouldn't hurt to give them some CM Plus capsules, a couple of those twice a day, CM Plus capsules to reduce the inflammation. But you might check that dog food out and make sure that it doesn't have any gluten in it. You want a grain-free dog food for this big boy, okay?
She said it is gluten-free, so hopefully that'll work, and I'll pass it on. Thank you, Doc.
Okay, great. Hey, thank you. Let us know what happens here, okay? But that dysplasia should resolve itself pretty quick. Okay, Doug, how much time we have here?
Just a little over a minute.
Just a little over a minute. I'm going to give this one to Shar. Shar, we've been doing a lot of meetings and things, a lot of things going on here. What's some of the new things that you've seen out there? Some things, some striking example of why people need to stay away from the bad things and supplement properly. Why can't they just get everything they need by just eating well?
Well, because the soil is depleted of minerals, and if there's no minerals in the soil, there can't possibly be minerals in the plants or the fruits and vegetables.
Yeah, how many minerals can the fruits and vegetables create?
They can't create any if they're not. They got to take them out of the soil. They're like little strip miners.
Exactly, and if there's nothing in there, there's nothing in the food.
Exactly,
and so. One of the things is that, I've been talking to people about you and me. We've been working at this together for 25 years. I'm telling them that we're setting the goal for 200 years from 25 years ago. So we got 175 years left in our 200 years of working on this. And I believe it's possible. With all the birthday announcements and obituaries you read over the 25 years, do you, in your heart, honestly, do you believe that human beings can live to be 200 if we do everything right?
I know they can because Dr. Lee lived to, I think, 256, and his obituary was written up in every paper in the world. He died around the Depression.
Yeah, 1933. Yep.
and that he was the basis of that movie and the book Lost Horizon. Okay, so thank you, Shar, for your insight. Thank you so much, Doug and Richard. Superlative job as usual. Great testimonies and questions today. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.